But first, we do want to talk about World Epilepsy Day. Today is Purple Day. It's a global initiative to raise awareness about epilepsy. And joining us this morning is Dr. Marawar from Wayne State University live to discuss the condition, ongoing research, and advancements in treatment. So, Dr. Marawar, we appreciate your time this morning. For viewers that might not be familiar with epilepsy, can you explain what it is and how it affects folks?
Good morning, Tanner. Great to be here. So epilepsy is a neurological condition. It's one of the most common neurological conditions that results in recurrent unprovoked seizures. And approximately 1 in every 100 people worldwide has epilepsy, and 1 in 26 people in their lifetime will develop epilepsy at some point.
Okay, so very prevalent. So it's always important to be on the lookout for signs and symptoms, I guess. And the importance of Purple Day or World Epilepsy Day is to raise the global effort and to raise awareness for epilepsy, right? So why is it so important that we have this Purple Day?
So, as you rightly mentioned, it is a global campaign dedicated to raising awareness, reducing stigma, and advocating for the rights of individuals living with epilepsy. And it's important because even now, epilepsy carries a lot of unnecessary stigma, which means children in schools, people at workplaces, don't receive the same attention as they should. And it's important to kind of make sure that everyone has equal rights, even if they have epilepsy.
Yeah, so I want to talk a little bit about how you mentioned that there's quite a stigma around this neurological disorder. It's pretty common, but it's also pretty misunderstood. What steps can be taken to reduce the stigma?
So I think it starts at home. I think patients and their caregivers need to be aware of everything that is epilepsy and seizures, workplace initiatives, social programs, public awareness campaigns, school education programs. I think all of these go a long way in decreasing the stigma, and many of these are already being carried out by hospitals, institutions, nonprofit organizations like Epilepsy Foundation, and these need to continue to reduce the stigma.
Yeah, Dr. Marawar, I'm curious about the symptoms. You know, I think a lot of people don't know what to look out for when it comes to epilepsy. Is it something that could just rapidly onset, or are there things that folks should be looking out for in terms of signs and symptoms for maybe a first episode?
Yeah, excellent question. So I think there are two important things to differentiate here. One is the seizures, which is the symptom. Not everyone who has seizures develop epilepsy. So for epilepsy to happen, one needs to be having seizures recurrently and unprovoked seizures. So seizures by themselves can happen in a lot of different conditions, such as electrolyte abnormalities, high or low glucose, brain trauma, but not all of them lead to epilepsy. So for epilepsy, there are different reasons. Common amongst them are stroke, brain trauma, also other conditions such as congenital malformations of the brain. Sometimes it's genetic, but there are different types of seizures, and the commonest one is also called grand mal seizure, which medically it's called tonic-clonic seizure. So this is the episode where someone falls to the ground, becomes stiff, and starts shaking all over. But there are other subtle signs of seizures, such as some people have just stirring episodes where they stare and don't respond for a few seconds, up to a minute, and they might be confused or tired afterwards and have no recollection of that event. So there are different ways that seizures can present, and seizures can start at any age, right from a newborn baby to someone who's 90 years old.
So it really does sound like there are a wide range of symptoms that could impact anybody from, like you said just now, you know, our smallest humans to an adult person. So
Yeah, with all of these different symptoms that can come from having epilepsy, from just seizures going to grand mal seizures even, and all of these additional symptoms that somebody can experience, there's a lot of misunderstanding around epilepsy. How does the medical community go about making sure it's a little easier to diagnose and treat epilepsy?
So I think it starts with education in the clinic or in the hospital, letting patients and their caregivers know the difference between seizures and epilepsy, and letting them know that even though you might have seizures or epilepsy, you can still live a very fulfilling life. We have many medications at this point probably more than 25 medications that are available to treat seizures. And most people with seizures, like I would say around 65 to 70% of people with seizures, respond very well to medications. And so I have lots of patients who are taking medications for their seizures, but they work, they have a family, they drive because their seizures are controlled, and otherwise live a very fulfilling life.
So it sounds like there are ways to be able to manage seizures and epilepsy as time goes on after you're diagnosed. I'm curious about some of the ongoing research there that you guys might be dealing with at Wayne State or in other areas of the medical community. What are some ongoing researches or things that you guys are researching that maybe families should be aware about on this Purple Day?
Yeah, so we do a lot of clinical trials for new and upcoming medications. We're also doing some uh, clinical trials, which is based kind of, if in layperson terms, it's based on kind of stem cells, where cells are inserted in the brain, and from the part of the brain where seizures are occurring, and these cells kind of try to repair that part of the brain to stop the seizures. So these are some of the clinical trials that we are currently doing. We're also doing studies that specifically look at people who have Alzheimer's disease or other kinds of dementia, and also have seizures at the same time.
Yeah, I'm interested to hear more about, are there other illnesses, are there other disorders that kind of go hand in hand with epilepsy that you keep an eye out for usually?
Yeah, so I think the kind of way to look at it is which conditions lead to seizures or epilepsy, and then which conditions does epilepsy cause. So some common other neurological conditions that leads to epilepsy are stroke, dementia such as Alzheimer's disease, brain tumors. But there are also other conditions which occur simultaneously with epilepsy very commonly, such as anxiety, depression, ADHD. So around 30 to 50% of people with epilepsy also have a psychiatric comorbidity.
I want to ask you something about the primary challenges. What are some of the things that makes diagnosing and treating epilepsy difficult, and how can folks that are dealing with it kind of work around that? And how do you guys as doctors work with that as well?
Yeah, great question. So I think as doctors, we really need to get a very thorough information or history from people who are coming to the clinic or the hospital with potentially seizures. It's very important to get witness history. So someone who was with the patient when this episode occurred, many times that kind of makes or breaks the diagnosis of what the patient is coming in with. Uh, and it's important to then kind of understand that what could be other things that could be happening that look like seizures but might not be. Sometimes passing out episodes, which we call syncope, could look like seizures. Sometimes a condition called functional seizures, where it looks like seizures, it feels like seizures to the person having them, but this is a psychiatric condition where their brains are just wired differently, which leads to a seizure-like episodes as the physical manifestation of stress, or sometimes even when there is no stress. And most of the information should be obtained from both the patient and anyone who has witnessed these episodes.
All right, Dr. Marawar, thank you so much for helping us raise awareness on this issue again. It is Purple Day that will help raise awareness of epilepsy, the signs and symptoms to look out for, as well as how to manage that. Dr. Marawar with Wayne State, we appreciate your time this morning.
Thank you so much for having me.